protecting yourself is also a very important part of catering to your health, your safety, and even your overall well-being. And that's why we brought this conversation to you this morning regarding health insurance. I do have an insurance expert joining me for this conversation, but before I get to introductions, I should of course give you some sort of foundational understanding of why health insurance is a conversation that we should be having with each other. Now, with the ever-increasing cost of healthcare in Nigeria and the prevalence of ailments or diseases, health insurance has now become a necessity in Nigeria. Now, a recently conducted survey has revealed that only 17% of the country's population have health insurance coverage. Globally, health insurance enables universal and integrated access to health services. However, in Nigeria, there is inadequate knowledge, awareness, and capacity regarding insurance-based health system. Quality, affordable health care is the foundation for individuals to lead a productive and fulfilling life, and even for countries to have strong economies. Hence, the need to bring the conversation on health insurance to the fore. Now, once again, joining me this morning to discuss the barriers, the facilitators, as well as the importance of health insurance is an insurance expert, Olalekan Richard Anigilaji. A pleasure to have you. Good morning. Thank you for joining us.
Good morning, Lagos. Thank you for having me.
Of course, it's definitely a pleasure. So, health insurance. I mean, I believe that the introduction already sets the tone for the conversation. It captures why the poor awareness on health insurance has become something of a problem for us, and how it is directly linked to the increasing mortality rates that we have in the country. I don't know if you're aware, but it was reported in the papers that the cost of healthcare has gone from 60% to 150%, and people are running away from the hospital. Once you give them their prescription, headache is 60,000, bye-bye, they run away, and they don't come back until they are at the point of death.
Sure.
A situation that health insurance would have been able to take care of.
Yes.
So we've said health insurance like 150 times, and it would be nice for us to explain what health insurance is, so people are not lost. Like, why are these people saying health insurance? What do they mean? So, Richard, talk to us. How would you explain health insurance as a concept?
All right. I like breaking down words. Right. So I want to educate us about the meaning. What is health? Health is being in a good state of mind, free from injury, free from illness, both physically and mentally. All right. Having said that, what is insurance? Is a very popular word, but many people don't really understand the nitty-gritty. Insurance is a contract or an agreement between an insurer, which is the insurance company, and the insured, which is the person patronizing the insurance company, to secure their loss financially on any sort of plan that they bring or have with the insurance company. Do you understand that? In other words, health insurance is having a coverage for you in case of any form of financial incurement or loss when it comes to your health.
Simple. It's giving Walishoyinka. It's giving. Thank you so much for that breakdown. So basically, a coverage on any financial situation that you might have regarding your health. Again, let me further break it down. So when you get to a situation where you need to pay for your health to be, certified in a manner of speaking, something that provides that coverage, that certification, that protection for you. That's pretty much what health insurance is all about. All right, since we're focused, I know that there's insurance as a broad term, but because this is a health show, we're focusing primarily on health insurance. So, are there types of health insurance? Because I know that there are many aspects, there are many indices when it comes to health insurance. And when I say types, I mean types like individual, for groups, for families. Are there different concepts? Are there different types? Are there different terminologies to describe it? If there are types of health insurance, what are these types and what makes them different or similar?
All right. Basically, in Nigeria, we have two major types of insurance.
Okay.
We have the HMOs.
Those are the most common, I believe.
Yes. What do you mean by HMO? Health Maintenance Organization.
Okay.
Those are the persons that handles the insurance cover or coverage. you meet with them, they now attach you to a facility close to you or closer to your
place of residence
where you reside, So we also have some that are called preferred provider organization. This type of insurance, they deal with organizations like a company that has a lot of workers. In this type of insurance, the insured, which is the person, like the worker, does not have the right to say this is the type of insurance I want, or this is the type of coverage I want. Is the company that was okay, based on your salary, we have chosen a particular type of coverage for you because you are not married, or because you are married, because this, then they deduct a certain amount from their the money they are paying to the worker. But generally, that PPO, which I called preferred provider organization, they are the ones that meets with the company, then they cover all their workers. But the HMOs, they are also into companies, but not the bigger ones like we have, and you can also meet the HMOs individually. Okay, the company has done this for me, I want to pick for myself, and I want this type of cover, I will pay on my own. Whereas the company you are working with can as well meet with them, okay, cover our staffs. Most times they are not all these wide companies that have a lot of workers. So individuals, those that are employed and that are not employed, can actually meet with HMOs. Those are the common ones. You know why? Their charges are minimal, and they do not look for the big. But the first one I made mention of, they meet with the
body that works in the organization, and you can't pick the policy you want.
Yes,
it's just the company that would.
In the first one, they already have their own hospitals.
Okay.
But for the HMOs, they just tell you, okay, pick the company, pick a
hospital or health center close to you. Okay.
And they will just be paying.
Right.
Now, insurance comes in for every one of us. It's very important for every one of us, because, like you said earlier, most of the bills are now on the high side, close to 80K at the hospital. I now told him, I said, why didn't you go for health insurance? This 80K can actually, for only you will still collect some change from this money annually if you are the only one. But if you are having your family, it might be a bit
on the high side,
more than that. But why wasting this? You just go to the hospital. Like for me, I have my, whenever I want to, I just go there. They treat me and I go.
Let's talk about picking up the policy. I'm glad that you separated the HMOs and the PPO. So let's focus on the HMOs, since that's more individuals, right? So people that can easily pick it up and decide the policy that suits them and also their financial capacity.
Right.
So how can people get health insurance? When you approach an insurance company and you want to pick up a health insurance policy, what are the processes involved? What do they ask you? Do they ask you how much money do you make? What are even the policies available that people can pick up? Does it cover only one person? Can you pick a policy for another person? What are some of the health conditions that are covered? How long does this policy cover you? Just the details like that. Can you provide us with that?
Majorly, insurance covers are always annually. Okay, you pay annually and they cover you for the whole year. Now, if you meet with them individually, there are a lot of there are you don't have to go through a lot of questionings, because do you know in Nigeria is a must that everyone picks insurance under the law. Many of us are not aware of that, because the government actually has what we call NHIS.
Yes.
Now under the new Reform Act in 2022 is now National Health Insurance Act, but still the same
policies and all.
Yes, but the act states that every Nigerian, I repeat, every Nigerian must have an insurance cover. So if you can't meet with the HMOs, the government has their own NHIS which you can subscribe to, but they are subject to government hospitals. government-owned hospitals.
So I'm sorry, if you pick that particular policy,
yes,
that means that whatever you're treating must be done at a government-owned
yes,
hospital.
yes,
that's just the only condition. All right, go ahead, please.
All right, so there's no long conversation when picking it up. You just, on your phone, you can go to the types of HMOs that you have. You look at the ones that suit and they have different prices.
Okay.
You meet with them. They tell you this is the package for singles, this is the package if you want to add family members. If you are married, this is the total number of persons you can add for this amount. If you're adding so number of persons,
you have to pay more.
That's stages. If you have a kid, there's an amount you pay. Your wife, yourself, and a kid. If you have two, there's an amount you pay. Because this thing is
the higher the family members,
yes,
the higher it's called premium, right?
Premium is the amount
you pay for insurance.
So there are a lot of packages, depends on what you want, and they tell you how much you will pay. And there is a contract that is signed between the two of you, and then
the contract is annual, by the way. So in the event that you pick up a health cover, right, for yourself, your family, and you do not fall sick, you don't have any medical condition, nothing happens to you, that money that you have paid, what happens to it?
Nice question. Insurance is a pool of risk. Do you understand? The insurance company is actually taking a risk on you. If you are picking up an insurance, a health insurance plan, you are actually pushing the risk of falling sick, the risk of having any health issue on the insurance company, and they are taking it up in return for your premium. Do you understand?
So really gain though, because the money you've paid would be forwarded to somebody else who falls sick.
I'm going there.
Is there a system like that?
I'm going there. I'm trying to explain something. A pool, putting like a ball in a pot, like 1,000 persons. In 1,000 persons, 1,000 cannot fall sick at the same time. Do you know? The 1,000 are paying premiums, right? So if 200 fall sick within a year or within a month, it means within that year they have an excess of 800 to maintain. That is why some persons say, how do insurance company get their money? It's a pool. So there's no way. That's why the more persons that picks up the plan, the more strength the insurance company has
to cater to those who actually fall sick.
Yes.
All right. Because of our time, we barely have less than 2 minutes to round up this conversation. I am so sorry. But then, when you're picking up a health insurance policy, like you said, the prices depend on the package that you pick or the policy that you pick. How many people you're picking for? If it's family, if it's individual, that's what determines the price. Now, and also, if you don't fall sick for the year, like you said, is a pool of risks. Somebody will fall sick and would benefit. And then when you fall sick, you would also benefit from the fact that there's certain people paying insurance as well. So what are some of the exceptions? For example, are there conditions that insurance policies will insurance companies would naturally not take up? For example, a person who has a heart condition, a person who suffered from maybe an incurable disease. If the person approaches a company, they know that they would have to fall sick because they're dealing with a terrible condition that is maybe incurable. Will an insurance company pick or allow that person to pick a policy because of the risk that is involved? In what situation would an insurance company say, I'm sorry, but you cannot buy a health policy with us?
Okay, you see, health insurance policies varies. There are critical conditions that are exempted from the normal plans. So if someone is in a critical health state, this is what I want. You pay higher.
Right.
Yes.
So they don't turn you away. You just pay higher.
In fact, it's against the law to turn you away.
Right.
Except you don't have the capacity to
pay for the policy you're picking.
It's just that you pay higher. There are different policies. If you have like for the ones I said earlier, okay, if you are going for you and your family, there are some exceptions. Exemptions that, okay, if so ailment, of course, we may not, it is not included in this unless you pay so amount, then it will be included. You know, not all as dental this thing. Some persons don't even visit the dentist for a year. You know, they feel they don't want it. Okay, remove this, then my premium comes down. Add this, then my premium increases. Do you understand? That's how it works. So for critical conditions, there are special plans for that, and then you pay for it.
All right, so nobody gets turned away.
No.
There'll just be an adjustment to the premium that you pay. Yes. All right, so we have to go, but final words. The thing is, we have to bring back this conversation and spend more time talking about it, so people understand why they need health insurance. I just wanted to get through the most important parts: why you need an insurance policy, the policies available for you, singles, family, the ones for individuals, the ones for organizations, and also how you go about the payment of your premium. I know there are more conversations around this, which we will get to another day, when maybe next week or anytime you're available, we'll come back to talk about health insurance. So final words before we go. If you were to talk to somebody about health insurance, what exactly would be something that you would want to register in the mind of who you're talking to?
Wow, health insurance is compulsory. In fact, it's not a luxury. When you are planning your finances, we get to know that many Nigerians, we don't plan our health to it. We just believe there is no need, but it will surely come up. Is it possible to stay healthy throughout the year? No. One way or the other, we self-medicate. You know, we go to the pharmacist and say, just give me this, and it's wrong. So when you are planning your finances for the year, always attach your health and
Mr.
everything.
Richard, we actually have to go. I am in trouble, but thank you so very much. Next time we're going to have you join us to talk about the importance of health insurance. Coming up next is Still on the Matter. More conversations coming up on Mainland 98.3 FM. My name is Sage Babalola. Stay here on Mainland 98.3 FM.
When the airwaves in your market become more and more crowded. It's time to break it open and really stand out. It's here.
Mainland 98.3 FM, the sound of Lagos. When your whole world comes crashing down, please look up. Assemble the team and showtime reigns. Wake it up.
What'd you have for breakfast? We are the sound of Lagos, and this is Mainland 98.3 FM.
You didn't see that coming, did you?
E go better. Nine Nigeria take the way it is so. E no concern me. Now so food where they for fire take the bond. Make we live, it go better, and it no concern me for Igbo people, because those ones na grammar. It don't reach time where everybody go they chook mouth on top the matter where they ground, so that we go the reason to